Dr. Max here. I hope you're all doing well. Today we're going to be talking about the immune system, defense, repair, how the immune system changes, modulates, and responds to different types of threats, and how that's related to chronic pain, chronic inflammation, and certain digestive issues. This is a newer video for me. Some of it may be a bit technical. This was modified from when I was teaching applied nutrition at Lifewest Chiropractic College. So if this is a bit too technical, let me know. I'm considering toying with this video, changing it around a little bit, so I'd love your feedback. The immune system overview. Now, before we get into it, little disclaimer, this video is intended for educational purposes only and is not medical advice, diagnosis, or treatment. Health coaching services do not replace licensed medical care. Individuals with persistent or severe symptoms should consult an appropriately qualified healthcare professional. Now, the disclaimer's out of the way. How best to learn this information? It's best if you can break this up in 7 to 10-minute sections. That will make sure you're actually retaining the information, learning what you need to. Make sure to take notes if you can. Best to do that by hand because your brain will connect it better if you are using the rest of your body rather than just typing. Make sure to ask me questions if something doesn't make sense or you want some clarification. Feel free to reach out to me on WhatsApp, email, what have you. Ask your questions and I'll answer what I can because the point of this is to try to help you learn more about your own anatomy, your physiology, how the body works, so that as we're working together, we can help to resolve some of these chronic issues, but more importantly, once you're feeling better, you can keep it that way. And if you need, make sure to watch multiple times. So the organs of the immune system, rather than the immune system being like a particular part of the anatomy, you could sort of view the human body as the immune system. And the different organs all have different functions that support that. Generally speaking, though, the ones that are most important to direct immune system responding to threats are the lymph moving throughout the body, our blood, the skin, which acts as a physical barrier, the gut, where 80 to 85% of all of our immune system cells live, the bone marrow that grows and produces new blood cells, the spleen that helps to filter blood, and the lymph nodes where our immune system is trained on different threats. So the main point of the immune system is to determine, are you me and are you dangerous? We have two major branches. The innate immune system is one we're born with. This is not specific to any particular type of threat. It's a general immune response that's mounted against any threat to try and keep us well. And then we have the adaptive immune system. This develops with time. We have to have exposure to certain threats, certain infections. It's specific to a particular organism or threat, and a person can live without it, although it can be more difficult. So who are the players of the immune system? Blood cells are primarily created in the bone marrow, and they're divided into different types from those stem cells. So we have a hematopoietic stem cell that's divided into two major branches that we're going to go over. One is the innate immune system and other general functions, and one is the adaptive immune system that's more specific to certain threats. Oh, and I just discovered that, or I just went over that. So regarding the innate pathway, we have this progenitor, this precursor here that splits off into megakaryocytes. Those turn into thrombocytes, help us with blood clotting. Erythrocytes, these are the typical red blood cells that help to carry oxygen and iron throughout the body. Mast cells that are related to allergies and worms, mast cell activation syndrome, and histamine responses, if you're familiar with that, which can be related to chronic digestive issues, brain fog, joint pain, skin irritation, what have you. And then we have myeloblasts, and these break down into several different types of white blood cells. Basophils, which are related to allergy response and chronic inflammation responses. Neutrophils, which are sort of the beat cops out surveilling the body in different tissues and fighting off general infections. We have eosinophils. They're primarily related to allergies, but also histamine and chronic inflammation. And then we have the monocytes that become active in different tissues of the body, and they become macrophages, which are big eaters, and they go around and eat up threats. And we'll get more into those in a minute. Then we have the adaptive branch of the immune system that can turn into natural killer cells. These are anti-cancer, and they will surveil cells to see if they are cancerous, they're not programmed the way they're supposed to be, or if they're infected by an organism like a virus or a parasite and try to kill those. And then we have the small lymphocytes that branch off into the T cells and the B cells. The T cells are like the conductors of the adaptive immune system. They differentiate into different types that will produce different immune responses depending on the threat we're dealing with. And then we have the B cells that create antibodies to fight off known infections, and that can help be more specific to a particular threat by releasing different types of antibodies in different shapes. As I said before, the B cells make antibodies. They recognize sort of extracellular threats, things outside of a cell, whatever the immune system is directed towards, whether that's an allergen, a parasite like a worm, certain infections. Again, the T cells are making cytokines. These recognize more inside of the cell problems. These cytokines are basically messengers. They act like the hormones of the immune system, and they activate the rest of the immune system and sort of orchestrate and tell the immune system what sort of response we're going to have. The T cells will also differentiate into other types, T killer and cytotoxic T cells that kill infected and cancerous cells, respectively. As I said before, the T cell is the maestro of the immune system. We have a bunch of different T cell subtypes. Don't let this graph overwhelm you. Basically, the idea is certain subtypes, certain types of T helper cells help us with different types of threats. Th1 helps us fight off bacteria and viruses. Th2 is primarily for fighting off worms or dealing with allergies. We have Th3, very important, also known as T regulatory cells. These T3, these T regulatory cells help us recognize when things are food, and they produce a tolerance to things. So we're not fighting off normal, expected microbes in the gut. We're not producing too much inflammation to food. We're not attacking our own tissues. These are regulating ones. Th9 cells, these are associated with asthma. Th17, very important in the research lately. This is related to mold exposure. If you're dealing with a lot of mold, like a lot of people I know in the Pacific Northwest deal with, or if you're dealing with autoimmunity, people with chronic digestive issues have an increased chance of developing autoimmune conditions, whether that's inflammatory bowel disease, Hashimoto's thyroid, rheumatoid arthritis, autoimmune gastritis. The list goes on and on. Th17 are associated with those chronic inflammatory states. And then we have some other newer subtypes that we're just learning more about. And I imagine with all of the AI data synthesizing we're able to do now, we're going to learn a heck of a lot more about some of these certain cell types in the next couple of years. So I'll probably have to update this anyway pretty soon. So in terms of the B cells, again, these are the ones that produce the antibodies to help us fight off specific infections. We have a bunch of different types of antibodies. Again, don't let this overwhelm you. Listen to this in 7 to 10 minute chunks, write down notes, ask questions. This does get easier and will be simple to understand as we go along. IgM, this is an antibody that's generic, boom, just like a first pass, whatever threat you're dealing with, let's throw out some antibodies out there and see if we can bind it up and prevent it from becoming a big problem. Then we have different types depending on the threat. IgG is released typically in response to bacterial or viral infections. IgE is released in response to those like acute anaphylaxis, I need an EpiPen right now type of allergies. So if you eat a strawberry and your throat swells up, your body's producing that IgE antibody to create that allergy. It can also be released in response to certain parasites like certain worms. And then we have IgA, and this one is typically released in response to normal things that we're not supposed to produce a big reaction to, like food. So it helps our immune system learn to tolerate things. When you're getting an allergy panel, depending on the type of allergy you're dealing with, that can help reveal different things. So for those things that cause those anaphylactic, severe, like true allergies, you're going to get an IgE panel, and that'll have things like certain foods, animal dander, certain things in the environment like pollen or tree sap that people can get a major allergy to. Like a lot of children in schools now have major allergies to tree nuts or peanuts. This is different from, say, a food sensitivity panel that some of my clients and patients will do, where we're checking for IgG or IgA delayed reactions to things. So a common one is through Cyrex, and this shows IgG, IgA reactions to hundreds of different types of foods, cooked and raw. And this gives you an idea if your body has a food sensitivity or food intolerance. So IgE for those immediate EpiPen allergies, IgG, IgA for more of those delayed food sensitivities, food intolerances, things where like, oh, I didn't know I was gluten intolerant. I just suspected because I would eat something with gluten in it, and then for the next couple days I'd feel worse. So a difference in response there. So a little review, the organs of the immune system, the lymph, this is our drainage system and is sort of a highway for white blood cells to move around the body as they will. We have the blood, helps us clot from injuries. This is like the autobahn where the immune system can go through places really, really quickly, as opposed to the lymph, which is much slower, is more of a drainage system. We have the skin, again, a direct barrier. There are certain antimicrobial compounds produced in our barriers called defensins. There's the gut, again, where 80 to 85% of the immune system lives. Most of our white blood cells are down there. The bone marrow helps to produce more blood and immune cells generally. We have the spleen that filters blood and helps sort out different types of antibodies that our body's going to use. And then we have the lymph nodes, which are the immune system training grounds, where, say, we fight off an infection or we are exposed to an infection, our white blood cells will grab some of those microbes, take them to a lymph node and say, all right, we're dealing with this infection, disseminate these blueprints around for all of the other white blood cells to be on the lookout for this bad guy. So they're like, for lack of a better word, producing wanted posters that then the law enforcement, the immune system can go around and be on the lookout and be like, oh, I'm looking out for this guy, or I'm looking out for this type of infection. And when it sees it, it'll be able to respond to it more specifically. So we have the innate immune response, the first response to an injury or an infection. Again, we have those physical barriers, whether it's our skin, mucus in the mouth, the digestive tract, tears and saliva help to prevent microbes from colonizing, and we have the pH of the stomach to acidify and kill off infections. So I said before, the skin contains antimicrobial defensins, helps to prevent certain microbe overgrowth. Some people develop psoriasis, eczema. The defensins are there to help prevent some of that and to help kill off certain pathogens. So there is some acid in our barriers anyway. Vitamin D will help to increase defensin production. So if you're deficient, that's another reason why you want to get your vitamin D. Vitamin D is used by basically every cell type in the body, very important. We produce a lot of mucus that prevent adhesion so that microbes, rather than sticking to us, will slough off in our sweat, our stool, our urine, and just keep going. Our tears and saliva produce certain enzymes to chop up bacteria. How cool is that? And then, as I said, stomach acid will kill all types of things, including viruses. So in the intestine and in the gut, this can be really important because our immune system is constantly surveilling and sampling everything that comes through. You think about the digestive tract, it's basically a tube that our body has to analyze as food's moving through from the external environment. That's just a tube moving through us. And the immune system not only has to analyze that and keep us healthy, but it has to break down all the food that we're taking in, extract the nutrients, and keep the waste moving. So it's pretty remarkable when you think about it that way. So our immune system, again, is constantly surveilling and sampling things for threats. We're talking about food, microbes, heavy metals, pesticides, poo, whatever is going through you, they're sampling and surveilling. We produce this nice thick mucus layer there to help prevent some of these guys from adhering to us and keeping things away from the lining of the intestine. The lining of the intestine is only a single cell layer thick. So especially in the small intestine, you think about how small that is, just a single cell layer. We're talking like smaller than the tip of a pencil. So if you don't have that protective mucus layer, if you don't have a healthy, robust immune response, it's much easier to develop an irritated and inflamed gut. And when that gut barrier becomes irritated or inflamed, then all sorts of problems can happen. Again, there's a huge number of immune cells that live here. 80 to 85% of our immune system is in the gut. Very important. because it does a lot to help support us every day. And as we discussed in my video on the enteric nervous system, this is sort of semi-autonomous from the brain. So all of those minute to minute, moment to moment reactions are happening in the gut and the nervous system there. So the health of the gut is very important for overall function of the immune system. Um, the lymphoid tissue, the immune system in the gut, is known as the GALT, gut-associated lymphoid tissue, with all of those Peyer's patches and lymph nodes in there, all of that immune surveillance. It's pretty remarkable when you think about the thousands and millions of immune cells that are working every moment of every day to try and keep you healthy and keep your digestion moving. When you have chronic digestive issues, this will often involve that immune system dysfunction and dysregulation. The local environment in an irritated and leaky gut, or something that's been inflamed, ulcerated, dealing with an infection, can become hypersensitive. And as I mentioned before, those white blood cells are producing all these chemical messengers. And if the local environment is telling those immune cells to stay inflamed, to stay alert, then they're going to continue to produce inflammation and irritation and release compounds that can create pain, gas, spasm, irritation, mess with mood, mess with sleep, and our body's ability to digest and absorb nutrients and to keep waste moving. So we've talked a lot about leaky gut. The intestinal lining is a very selective barrier. Only certain things are allowed to get through. Certain immune cells are allowed to get through. These tight junctions, even though it's only a single cell layer thick, there are these proteins connecting, these molecules connecting these cells, these tight junctions. So they're basically impervious, trying not to let anything through. But there are a lot of common things that can impair that function, make them break apart, or make the actual cells get leaky so things can get through them. And some common things are periods of chronic or acute stress can actually do that. Drinking alcohol will cause leaky gut. It just does. It damages the lining of the stomach and makes the organs of detox, like the liver, focus on breaking that down at the expense of other things like moving digestion and removing other toxins. NSAIDs can create leaky gut, so another reason to not use those unless you have to, and only for a short period of time if possible. Infections, of course, can break that down. Irritation, sleeping poorly can do that, and having a highly processed diet that can irritate the lining of the gut or contains things like emulsifiers, polysorbate, that can basically act as detergents and strip away that mucus lining in the gut and wipe out microbes. Say if you're having foods with a lot of pesticides, herbicides, or maybe some antibiotic residue on it, that will all affect the microbiome too and can lead to leaky gut. When the barrier is dysfunctional, that can contribute to food sensitivities because suddenly things that normally wouldn't be getting through are getting through where the immune system is lying in wait. And then the immune system can treat that like an invader. And suddenly, boom, you're intolerant to certain foods. When things break through these barriers, the immune system is activated. So this usually happens, say, if you scrape your knee or get an acute injury in your ankle. This will happen in the first couple hours. The complement system is activated to help you clot, and certain inflammatory proteins are released. The most famous of which is CRP, C-reactive protein, which we'll get to in a minute, which is important to know when you're getting your own blood work. It's a non-specific measure of inflammation, but can be useful for telling us when the body is actively inflamed. It's associated with diabetes, with heart disease, with the flu, with gout. These all lead to massive increases in C-reactive protein. So normally we like to see that below 3, but it's not uncommon when the body is acutely inflamed to see 10 plus. So if I have someone with a flare of gout, it's not uncommon to see it 10 or above. Um, this can be resolved, with anti-inflammatory support, with resolving infections, with clearing out the insult in the first place, or sometimes just rest. So when you're looking at your own lab work, CRP, C-reactive protein, is a non-specific marker of inflammation, especially in the blood vessels, but can be very helpful as we monitor treatment over time to see how inflamed the body is or if you're in an acute flare. Now, the innate immune system, right away, the immediate response is to activate certain proteins to dump generic complement so it can kind of clump things together and prevent additional bleeding and leaking of fluids throughout the body. The complement will also poke holes in cell membranes. This isn't specific for any particular thing, but can help to slow down infection or to stop an infection at the source if you're poking holes in a bacteria, for example. That C-reactive protein will be increased, which draws inflammation and an immune response to that area. And certain immune cells will respond to that right away. Certain macrophages, which are known as the big eater, will start to eat up microbes or things in the local environment to see what the threat is, and other cells that are sampling and testing or releasing things that break stuff down, like neutrophils. These move through our blood, and when there's an area that's inflamed by this response, they will go to that area of the injury and start eating up and breaking down microbes. Inside them, they contain these granules that dissolve and are very toxic, and they will break up the microbes and help to slow down or kill off an infection. The macrophages are already present in our body tissues all over, but once they become activated, they are highly phagocytic. We call them the big eater. They will engulf and eat microbes. One thing that's different about the macrophages compared to the neutrophils, though, the macrophages will keep the microbes alive inside unless they've been instructed to otherwise by other types of white blood cells. And so you can even take those prisoners to local lymph nodes and they can figure out how to handle the threat from there. Dendritic cells, these are basically cells that have all these little outgrowths that are sort of like tentacles or fingers. They also eat a lot of things. They're constantly sampling and surveilling things as they move through our digestive tract. Similar to macrophages, they can carry microbes to the nearest lymph node for further analysis, and they're sort of our sentinels that keep us safe all day and all night. The immune system will opsonize, meaning they will cover microbes in a sort of like frosting, so to speak, which makes the pathogens a lot more recognizable. For example, gram-negative bacteria that have the LPS, the lipopolysaccharide on their outer membrane can be coated by these little flags, and that tips off the immune system like, oh, hey, here's one of the invaders right here. So it'll make it easier for them to notice them and to eat them and break them down. 4 to 3 days, 4 days post-injury, your body's going to bridge from that generic, immediate, innate immune response to the adaptive, specific immune response for whatever that threat is. And as I said before, the macrophages, the neutrophils, their goal is to keep the infection under control until you can generate a more specific immune response. There are natural killer cells that will also go around and recognize infected or cancerous cells. They will poke holes in the membranes of cells with perforin protein, and they will allow these little enzymes to float through the holes and kind of break down and dissolve the threat. A lot of common supplements and herbals and nutraceuticals like echinacea will help to support the formation of natural killer cells. So some of those immune supports, one of the main actions they do is help to increase the number of these natural killer cells to support that immediate innate immune response. And this is more important for the chronic inflammation, chronic pain, and digestive issues. As we said before, we have all these different subtypes of T helper cells, these white blood cells that determine what kind of immune response we're going to have. So don't let this chart overwhelm you. We're going to go over this information a couple times. You can always review this, break this video up, ask me questions. So we have the generic Th0. These are called naive Th helper cells or T helper cells. And depending on the threat or the response that's expected of them, they will differentiate into different types to perform different functions. When we're dealing with bacteria and viruses, they'll turn into Th1. When we're dealing with parasites or allergies, Th2. When we're trying to create a tolerance response and regulate, so we're not creating too much inflammation, we're not creating too little, the Th3 helps with that. That helps us recognize when something is food or when something is ourself. And then there's a couple other subtypes, the most important of which is mold and autoimmunity from the Th17, which is very inflammatory, and that can lead to all sorts of problems down the road. So when you have a bacteria or a virus, you're going to have that Th1 response. Say you get an injury, that innate immune phase begins immediately. You have these white blood cells that engulf microbes, bacteria, carry them to the lymph node where it presents the microbes to a T cell. The T cell says, oh, this is a bacteria. I'm going to release this chemical messenger, interferon, IFN. This tells your B cells which types of antibodies to make to fight off the threat. So it switches from the generic IgM to the more bacteria virus specific IgG to help combat the infection. And then it'll also activate more B cells to divide and produce more antibodies. So here's just a little drawing of the macrophage with the microbes that it ate, talking to a T helper cell saying, hey, I see this threat, be on the lookout for this. And then the T helper cell says, oh, this is a bacteria. All right, so we're going to produce certain chemicals to fight off bacteria. And then that T cell, which is the orchestrator of the immune system, will go to the B cells and say, hey, all right, we're trying to fight off a bacteria. This is what it looks like, so that the B cell can respond in kind with the correct antibodies. When you have that Th2 response for allergies, histamine, certain parasites like worms, say your white blood cell will eat up some of that worm, carry it to the lymph node, and alert the local T cell, hey, we're dealing with a parasite, it's a worm. The T cell will release certain chemicals saying, all right, we're fighting off a worm. We need to produce, more histamine. So we're going to go tell the mast cells and the eosinophils, those other white blood cells, to make more histamine. We're going to produce more mucus so that those worms can't stick to us. And then it will tell the B cells to release IgE antibodies, which helps to fight off allergens. So then it can also make it easier for mast cells and eosinophils to recognize when they're nearby that. If they're getting a lot of those IgE antibodies, they'll release more histamine, more tryptase, more of those inflammatory things to break them down, and the cycle repeats itself. This is the same process that happens when you're inhaling allergens like pollen, or if you're dealing with a lot of mold. You'll produce this same inflammatory histamine sort of response with mucus production. So what's inside the granules, the eosinophils and the mast cells, all the stuff that's very inflammatory. We have peroxidase, histamine, things that break down collagen. We have major basic protein, which is a toxin that just like breaks down mammalian cells, certain neurotoxins, because the immune system is trying to kill off a threat, right? The mast cells, again, will release histamine, increases blood flow, makes vessels more permeable, so it'll increase fluid buildup and edema. Certain tissue breakdown factors like tryptase or chymase, excuse me, and other inflammatory things to attract more white blood cells to the area to help out with the fight. Now, when it comes to chronic digestive issues, a lot of people are dealing with histamine intolerance. And so we know that there's a connection between irritable bowel and mast cell activation syndrome. And histamine is an immune signaling molecule that can have far-reaching effects, and it can go all throughout the body and influence a bunch of different areas. So we know as far as digestion goes, there's a connection to bloating and diarrhea, flushing of the face, feelings of anxiety, dealing with skin flares and reactions just like you would with an allergy, and why some people react to healthy foods. When people have that histamine response, especially if their white blood cells have become hypersensitive from being inflamed or irritated or a leaky gut for a long enough time, they can develop things like headaches, migraines, vertigo. They can have insomnia, major anxiety, difficulty breathing, a chronic cough, asthma, issues with their periods, muscle and joint pain and cramping, issues in the gut like more nausea or vomiting, diarrhea, loose stools, stomach pain, bloating, gas, a racing heart, palpitations, hives, rashes, itchy skin. So you can see how this can become really systemic if it's let to become dysfunctional over a long period of time, and how leaky gut which allows pretty much anything to get through the barriers that are trying to protect your body, your immune system is trying to use as a physical barrier, can be such a major problem. Now, when it comes to the immune system, we want to try to keep it in balance, depending on what it is we need. So Th1, if you're fighting off bacteria and virus, will damp down on the Th2 response, so you'll have more of an acute infection response, as opposed to if you deal with chronic allergies or you're fighting off a parasite. Th2 will damp down that Th1 so you can focus more on the allergen. The T regulatory cells decrease both of those responses because we're trying to create more tolerance. And so depending on what your goal, you can influence one or the other. So most supplements, herbals, nutraceuticals will affect these levels in some way, and many induce a general dampening response. So supporting that sort of like, nope, we're going to tolerate this thing. This is just a food. It's okay. Or nope, these are normal bacteria. Nope, this is just our normal, or this is our own tissues. We don't need a major immune response to that. Some things that help do that are like vitamin D that increases defenses and balances the immune response. Certain probiotics like bifidobacteria and omega-3 anti-inflammatory fats. Now, this can be helpful, but not always, right? If you're dealing with chronic allergies, for example, or chronic histamine response, then maybe you want to help improve that balance there. So if you haven't had like a bacterial or viral infection in a while, but you deal with chronic allergies and an allergy response to just about everything, then you may want to try and improve your immune system's ability to respond with that Th1 rather than Th2. And a good example of that is quercetin, which is a mast cell stabilizer, also known as rutin, R-U-T-I-N. Really common supplement. A lot of people really take this one. It can be very helpful and helps to increase the Th1 and reduce the Th2 response. Same thing with cannabis. A lot of people who are dealing with chronic pain will use cannabis or marijuana because that increases that Th2 by decreasing the Th1. But if you're dealing with chronic allergies or histamine, um, may not be the best choice for you. So it can depend on what you're trying to accomplish. One of the reasons why we need some of this balance is related to the hygiene hypothesis, which is that in the modern world, we're so much more sterile compared to our ancestors, and we have so much more exposure to things like antibiotics and antimicrobials, herbicides, pesticides, antibiotic residue in the food we eat, that our immune system has less experience handling chronic and acute infections, bacterial, viral infections, especially with the advent of things like vaccinations, and a much greater general response to allergens from the environment, pollens, tree sap, grasses, animal dander. So some things that people will do for their allergies is they want to upregulate that Th1 response or improve the Th3 dampening response. So they'll do things like allergy shots. In the early months of winter, they'll start eating local honey that has some of those local pollens in there that can help to class switch. It can help to train your immune system to switch from an allergy response with the IgE to an IgA food tolerance response. For example, taking a tablespoon of local honey starting in January so that by the time April, May rolls around when allergies are really in full swing, your body starts to treat them more like a food than an allergy. Another great way to do that is with some IgG powder. So one of my favorites is Mega IgG 2000 from Microbiome Labs. This is very basically immunoglobulins, antibodies from cow serum, cow blood. So rather than say getting it from colostrum from cow milk, they just take this directly from the cow's blood itself. So you've got all these antibodies you can just take as a very convenient powder or in capsules if you want. The gut immune cells will produce IgA antibodies to promote tolerance to food and normal things moving through the gut. So if there's a lot of that IgA from your gut immune cells just in the lining of the gut, your gut is much more likely to just recognize it as a food and a normal thing. If there's not enough of the IgA and there's too many inflammatory microbes, too many parasites, too many things that the immune system is going to respond to, then you can create a lot more inflammation, irritation, leading to food sensitivities, infections, or even autoimmune conditions. So having something like Omega IgG powder, that the antibody powder, can help the immune system class switch from um, an invader inflammatory response to more of a tolerance food response. And something that's really wild we know now is if the immune system loses the ability to produce that secretory IgA in the gut and help to promote that tolerance response, your immune system needs something to help protect you, and it will start releasing a lot more IgE, which is the true allergen antibody. So that's one of the reasons that people can develop more and more food intolerances or even food allergies over time if they have a really compromised, leaky gut, leaky barriers, and chronically inflamed immune system. How wild is that? Another great example of this is with asthma. If you have asthma, you want to try to upregulate, improve that Th1 response or that dampening Th3 response. Um, because asthma starts with an excessive Th2 response in the lungs and the respiratory tract. Eventually, that will switch to a more chronic inflammatory response that can be irritated via stress, certain irritants, certain foods. So, if you can treat that earlier and help to train the immune system with some of these herbs, these probiotics, these nutraceuticals, things like vitamin D, so that um, as you're not producing as much inflammation when you're exposed to things you breathe in with asthma, that can be very helpful in the long term so that it doesn't become a chronic issue. Now, I've been alluding to this. Autoimmunity can be a downstream consequence of the things we've been talking about. Leaky gut, dysregulated immune system, dysregulated gut barrier, because the immune system will class switch from, that Th1 uh, infection response or Th2 allergy parasite response, and can become confused and switch over to Th17, which can worsen autoimmunity. Th17 white blood cells are very pro-inflammatory, and they tend to build up more over time as the immune system becomes more dysfunctional. Um, Eventually, when the body becomes more sensitive to foods, normal microbes, normal things moving through the gut, the immune system can start to mistake our own body tissues if those body tissues look similar enough. This is known as molecular mimicry and is very well accepted in the medical literature. A classic example is the fact that gluten from wheat, rye and barley, or casein from dairy products can look very similar to some of our thyroid tissues. So people that have gluten and dairy intolerance or allergies, I'm among them, are more likely to develop Hashimoto's autoimmune thyroid because the thyroid tissue looks similar enough to gluten and casein that the immune system can mistake the two and start attacking your thyroid, even though it's just your own body tissue. Now, not all inflammation is bad. I always like to just add this in here because sometimes we do want some acute inflammation. Say if you have a brand new injury or an infection, you want to mount an immune response so that you can take care of it. The big problem is when we're dealing with that chronic low grade inflammation that's associated with gut dysfunction, immune dysfunction that happens over months, years, decades. But 48 to 72 hours post-injury, we do want that inflammation. It's necessary for healing and for the resolution of a trauma or an infection. Now, when it comes to IBS, SIBO, and immune system dysfunction, in IBS, we develop that sensitivity in the digestive tract itself, right? More spasticity, more sensitivity to just normal foods, or if we have a really large meal and there's stretching, and that can create irritation and release more histamine and more of that inflammatory stuff, as we talked about before. We can have post-infectious IBS, where if you happen to have food poisoning, for example, or get an infection, then IBS symptoms can persist for months or even years afterwards, unless you do some work to try and regulate the nervous system and the immune system again. And then we have that gut-brain immune interaction. Stress can play a big role, so trying to improve your sleep hygiene, how you're eating, your meal timing, making sure you're focusing on digesting, getting some time to rest, and not just scrolling on your devices, but actually genuinely resting your mind and body together can be helpful for that. When it comes to SIBO and bacterial overgrowth, we put some emphasis on the migrating motor complex, which is how frequently your nervous system is contracting your intestines and your digestion to keep things moving, and that can become dysregulated in people with SIBO that have bacteria growing where they oughtn't to be, where they ought not to be. Um, Food poisoning and autoimmunity is related to this as well because the food poisoning, just like IBS, produces a lot of inflammation, and even weeks or months afterwards, it can take a while for the immune system to get back to business as usual, especially if you don't do anything to help resolve it other than, say, um, you know, take some antibiotics or relieve it from both ends, if you catch my meaning. As far as gastritis, inflammation in the stomach goes, the immune system can become hypervigilant to just about anything, to the point where even drinking some water can create some irritation if the lining of the stomach is inflamed or is dealing with an ulcer or is trying to combat an infection. A common one for some people being H. pylori, but that's not the only one that can cause gastritis. Some other common ones are E. coli, especially if you're not producing enough stomach acid, or Candida yeast overgrowth. And stress will have a huge response on how permeable the gut is and how sensitive things are. So a lot of people that deal with acute or chronic stress can develop a nervous stomach that you'll often hear people talk about, especially if they have to perform or get in front of a group and they get that nervous stomach, butterflies in the stomach. That is a stress response that can lead to gastritis, chronic inflammation in the stomach, and can affect the integrity of the mucus lining and the barrier in the stomach or the intestine. When it comes to IBD, inflammatory bowel disease, of course, we have an autoimmune condition. So we're dealing with just immune overactivation in general, and that can lead to a loss of tolerance to just normal bacteria or just foods moving through the body. And that can become a big problem because once you lose oral tolerance, once the immune system stops respecting, like, oh, this is just a food, oh, this is just a normal bacteria, then it can be hard to calm down the inflammation. And sometimes people need really strong anti-inflammatory prescription medications to calm things down. That a major difference there with the immune dysfunction between IBS and IBD. In IBD, of course, the immune response is really aggressive and inflammatory and can create ulceration and stricture and bleeding and things like that, as opposed to IBS, which is more of like hypersensitivity and bloating, gas, and altered motility. In IBD, of course, just like with any of these chronic digestive issues, always make sure you're managing them with your primary care doc, your specialist like your gastroenterologist, and not simply relying on inflammation or information from Instagram or even health coaching from me. Make sure that you have a team effort here. Now, some things that can help to increase T regulatory cells, that sort of dampening general like tolerance response at the expense of other things like fighting off infections, allergies, or the autoimmune, include certain probiotics. And I just included a link to a really awesome website that has all the latest information on different strains of probiotics and what the research evidence shows that they do. A lot of the probiotics I use in the clinic have evidence showing that they help to support long-term resolution of inflammation in the gut, help support diversity, the healing of the gut barrier of that leaky gut, and supporting the mucus lining in the intestines. Another good one is alpha lipoic acid. This is an antioxidant that's both water and fat soluble and used by all sorts of different cells to fight off free radicals and inflammation. Vitamin A, very helpful for the lining of the intestine and supporting the immune system. Very underappreciated, helps train those white blood cells in the gut how to tolerate or respond to infections or foods more appropriately. Of course, you want to clear out a dysbiosis or of an infection if that's a major issue for you. If you are the type of person who's been on a lot of rounds of antibiotics, that may not be the way to go right now. You may want to focus on rebuilding some of the good guys and establishing a better gut terrain before you clear out some more dysbiosis, but it depends on the person. Vitamin D, of course, very beneficial for all types of different body tissues, but especially the immune system and the gut, and is often just deficient in most people unless they're out in the sun a lot. Here in the Pacific Northwest, we only get that UV light that we need between 10 a.m. and 2 p.m. in the summer. So unless you're out every day in the summer between 10 a.m. and 2 p.m., you may not be getting enough vitamin D, and that can be important to test with your primary care doc when you're doing lab work. Certain omega-3 fats um, are very helpful. The omega-6 fat GLA is anti-inflammatory, and olive oil also helps to support T regulatory function. Green tea has a variety of different things in there, including the catechins and the chlorophyll that help to calm down inflammation and support T regulatory function. Avoiding excess sodium. If you're primarily making most of your foods at home and you're just salting to taste, that's typically not a problem. But if you're eating a lot of processed foods or a lot of very heavily salted foods, sodium can create more inflammation if you have too much of that in excess. And of course, removing exposure to molds if you need to do some mold remediation in your home or your local environment, and avoiding too much exposure to local allergens. So things like a HEPA filter or furnace filters, car filters can all be very helpful to filter out some of that stuff so we're not just chronically bombarded, especially during the spring and the summer. Okay, so the gut microbes help to train the immune system, just like the immune system can help determine the response you're going to have to gut microbes. Certain microbes, especially the ones that have some research evidence behind them, certain strains will help to support that T regulatory response, as we just alluded to. And some of them can help train more of an inflammatory response. Like E. coli is a classic one. E. coli is very common. Most of us have a significant number of them. Certain types of E. coli are more damaging than others and can create food poisoning, but all types of E. coli have that LPS uh, on the outside of their membrane that the immune system responds to with inflammation. And if the body is constantly exposed to, say, a bunch of LPS because you have leaky gut and all this E. coli is leaking through the lining of the intestines into your bloodstream and your lymph, that can train the immune system to just be hypervigilant and inflammatory all the time, which is another reason that leaky gut is so important to work on. As far as the immune system goes, too, generally speaking, we know that the more diverse and resilient the microbiota, the microbiome are, the better we're able to respond to infections, to stress, to injuries, traumas, to major life events, and the less likely we are to develop a dysbiosis and imbalance in our microbiome as time goes on. Because the wider the diversity and variety of your microbiome, the more different threats and problems you'll be able to manage and be able to bounce back from. The microbiome is also responsible for producing short-chain fatty acids, especially butyrate. These breakdown products of different fibers and foods that we eat that are very important for microbiome health. They help to feed the intestinal lining by producing a lot of support for our mitochondria. So our colon and intestinal cells can create a lot more energy. And the short-chain fatty acids are also known to help support the healthy microbiota, so the good microbes, as well as brain and heart health as well. The beneficial bacteria help to regulate inflammation by supporting that T regulatory response, and having excessive antibiotics, antimicrobials, or foods with a lot of pesticides, herbicides, antibiotic residue can disrupt the microbiome. Let's see. I don't know why this one's small, but in terms of foods and how that can be helpful, fibers help to provide not only more binding of toxins and bulking up the stool to support regularity, but certain fibers can be broken down into those short chain fatty acids, as we talked about, like butyrate, feed the microbiota and feed the intestinal cells as well. Polyphenols are chemicals found in plants that give them bright colors. Some common examples are berries, cacao, coffee, green tea, and chlorophyll. These polyphenols all help to feed the good microbes in the gut. They help to calm down an inflammatory response and help to support longevity genes, which I think is pretty cool. Um, Having a more stable blood sugar will help to support a more balanced microbiome, because having high or low blood sugars puts a lot of stress on the body and the organs, which can create an inflammatory response. Too much sugar can also reduce immune system function and make it less likely that our white blood cells can eat up microbes and infections and not produce enough of a healthy response. Ultra-processed foods tend to have a lot of inflammatory junk in them. It's harder for our immune system to recognize them as food, increases the chance of eating things that are rancid, like oils that are cooked at high heat, like French fries. The oil tends to go rancid really fast on those. High heat and processed foods tend to have more carcinogens, cancer-causing agents in them that the immune system will react to. And ultra-processed foods tend to have a lot of extra additives and junk, emulsifiers that wipes out our microbiome, pesticides that irritates the microbiome, heavy metals, industrial byproducts, all sorts of stuff that puts additional stress on the body. So it's not just, you're having some French fries from McDonald's. You're also having a bunch of pesticides like Roundup, or maybe some heavy metals from the soil, or plastics, or industrial byproducts from the processing, like the food processing experience itself in the factory. So high ultra processed foods just put a lot of strain and stress on digestion and the immune system and make it more likely that we're going to produce a more inflammatory response. A good example of that being seed oils. Seed oils aren't necessarily bad in and of themselves, but those highly industrially processed foods like seed oils have a higher risk of being rancid or going bad during the process of cooking and getting them ready to sell on a shelf. They tend to have higher levels of more pro-inflammatory things like omega-6 fats, and they're often used in high heat cooking or ultra-processed foods that tend to have a greater chance of an immune inflammatory response in the first place. In terms of strategies, some people will do an elimination diet. I'll know a lot of my patients and clients do, because you have to stop putting more fuel on the fire if you want to try and heal. So elimination diets can be very helpful as a stopgap to try and reduce symptoms overall and help to identify which foods or things are triggering for a particular client or a person that's causing your symptoms and your issues. What I see as a big problem, though, is when elimination diets are done for a really long time, say more than a few months, because once you've kind of calmed that response down and you're starting to get some relief and a bit better, then you want to help support the microbiome, improve the terrain of the gut lining itself, support your nervous system, get more regular lifestyle habits, more rest, so you're not as fatigued, more relaxation. And then you want to try to expand the foods. Because as we said before, the more diverse, the more different species you have in your microbiome, the healthier you're going to be, the more resilient, and the more able to bounce back from things like stress, infections, traumas, or major life changes. Now, when it comes to modulating the immune system, I wanted to go over a few common examples here. You can see them all right there. Avoiding sugar, as I said before, ingestion of 100 grams of simple sugars decreases neutrophils' ability to engulf bacteria, and 75 grams in healthy volunteers decreased cell-mediated immune function. So if you're feeling sick, on the edge, dealing with chronic infection, inflammation, limit or cut back on sugar as best you can. Vitamin C is a very common one for infections and supporting the immune system, reduces the severity of infections in elderly and children in hospitals, has some direct antiviral activity, stimulates the productions of certain cytokines, those messengers that support the immune system acting, helps to inhibit or kill certain bacterial overgrowth like E. coli, staph, Pseudomonas, reduces free radicals, because white blood cells can produce a lot of free radicals when they're releasing their ammunition to fight off infections. Oops. Um, and can be taken safely in large doses each day, because the body will simply remove any that we're not actually able to use. Another really cool thing is that bell peppers have more vitamin C than citrus fruits. So as long as those aren't a sensitivity for you, they can be a really great way to get some vitamin C without getting a lot of sugar. Vitamin A helps to improve the ability of the epithelial cells in the gut to resist infection, and supports the formation of that secretory IgA, as we talked about. It inactivates a lot of viruses, and when we are acutely ill or sick, the body will excrete a lot more vitamin A. So when we are ill, having more vitamin A can help support the immune system and replete some of that vitamin A that was lost in the urine. As a note, pregnant women shouldn't have more than 10,000 IUs a day. And you want to have lower doses for elderly people or people with liver diseases and children. Vitamin A is one of the few vitamins that it's really dangerous if you overdose on. So it can be better to just make sure you're getting small, regular amounts or just having larger doses when you're feeling ill or feel like you really need it. Vitamin D, very common immune modulator. You can get it from the diet or directly from UV exposure. Vitamin D is a fat-soluble hormone-like vitamin. It's a prohormone similar to cholesterol or steroids like estrogen or testosterone. As I said, nearly every system in the body uses it. Helps to turn off inflammation by using that regulatory response. Um, and I found in my own capstone project that vitamin D helps to turn off inflammation locally in those white blood cells in the gut. So if you have that microenvironment that's producing more inflammation, vitamin D can help to power down that process. So very cool for chronic gut dysfunction. A great thing to do is determine if you need to get it from food, and not every supplement is made the same. Um, I had a friend who is a naturopath who was taking lots and lots of vitamin D, for the inexpensive kind that you can just get at discount stores like Walgreens, and her levels weren't improving, so she ended up needing a whole food version like this Cataplex D, and that was the one that finally got her levels up to where they needed to be, which is pretty cool. That can be the difference between whole food sourced, minimally processed supplements and just the junk you can find at Walmart. Another good one is zinc. Uh, Deficiency is common if you're eating the standard American Western diet, and it increases your susceptibility to infections. A cool study showed that 45 milligrams a day for a year decreased the frequency and severity of infections in middle-aged and elderly people. I do a zinc status test with all of my patients here in clinic to see if they need zinc. But if you are having zinc for a long period of time, say a month or longer, you should have it with some copper or maybe also with some iron to prevent deficiency of those other minerals because they have competitive binding on the same sites in human tissue. Another common antioxidant, selenium. This is a cofactor for glutathione, that major antioxidant we talked about that's used by all different types of cells in the body. Good for the liver, good for the brain, good for the thyroid. Some viruses are more virulent when there's not enough selenium nearby. This is found in things like garlic or onions, which not everybody with IBS can tolerate, or broccoli, or even Brazil nuts. So some people will even take this as a supplement, and that's perfectly fine. Other people will just have some Brazil nuts every day to make sure they're getting some selenium. You do want to make sure you're having Brazil nuts that were grown in Brazil because the soil there has higher levels of selenium, say as opposed to up here in the Pacific Northwest or California, where our soil is very selenium deficient. Another really good one, garlic, one of my favorites. It helps to inhibit or kill all types of different bacteria, viruses, including herpes, the common cold virus. Garlic has a bunch of natural antiviral and antimicrobial compounds like allicin. So a cool hack can be to take some fresh garlic cloves, chop them up on the counter and let them oxidize in the air for 5 minutes. That will help to activate that allicin enzyme, which is very antimicrobial, antiviral. And if you can tolerate it, can be a great thing just to have in your food every day to support the overall microbiome. There's some research to show that some constituents of garlic may also help with the migrating motor complex, although as far as I know, the last time I looked into it, the connection wasn't totally clear in the literature. Another cool thing I thought here, there was a medieval recipe using cow bile and garlic, and it was shown that it can actually kill MRSA, which is pretty awesome. So some of these old remedies can be really powerful. Certain probiotics help to eradicate pathogens via competition in the gut, and certain microbes will produce antimicrobial compounds. Probiotics can help to enhance the immune response in the host, as we talked about over the last hour. Um, Daily administration of probiotics in elderly hospitalized people help to decrease the incidence of getting infections and decreased incidence of fever, gut and upper respiratory infections, and diarrhea in infants and children at daycare or at school. How cool is that? So here's a brand that I often like for people that are trying to find a good one. This is 24-hour fermented yogurt. When you ferment yogurt for 24 hours, that means the microbes are eating up almost all of the sugar and a lot of the lactose and some of the casein in there as well. It's a lot easier in digestion. A lot of the yogurts you'll find at grocery stores like Yoplait have only been fermented for 4 to 6 hours, so there still is a lot of sugar and lactose and casein. It's not as easy on the gut as the 24-hour fermented yogurts. When it comes to the immune system, certain herbs are used for their deep immune stimulating action. Examples include astragalus, which I use for things that drag on, astragalus for things that drag on. Certain mushrooms like reishi, schizandra berries help to stimulate those T regulatory cells, can stimulate macrophages or formation of natural killer cells to fight off infections, make more white blood cells in general, more antibodies, and can adapt to hormonal changes and support the gut-brain axis. There are also certain herbs that are known as like superficial immune stimulators that we sort of need in more acute infections rather than chronic things. These are things you may not want to use long term, like echinacea, because we want balance to the immune system. We don't want to be pushing one way too much more than the other than perhaps, immune regulation, as long as you're still reacting to infections. Some common examples, as I said, include echinacea, wild indigo, or Oregon grape, the constituent of which is berberine, which a lot of people will use for blood sugar regulation or as a natural antimicrobial. And some people will end up taking berberine for a really long time for SIBO, which I don't always recommend because we do need some of those good guys too. And long-term berberine use can kill off a lot of the good microbes. One of my favorites for acute infections, Congoplex, is a sort of an immune system superhero. I'll have patients take 4 to 6 an hour in acute issues. And then there's also a chewable version for kids. This was just a cool study from a colleague of mine about an ear infection and how these two supplements, Congoplex and Spanish black radish, that supports drainage and lymph and glutathione production, can help resolve an ear infection. Again, not medical advice, but I thought that was cool. So that was a lot of information. I hope you found that educational. I know we covered a lot of ground. I'm happy for feedback on this one because this is a newer video that I'm trying to modify from my previous lecture on the immune system to make it more beneficial for my gut health coaching clients. So you can see there might have been some jumping around there. But thank you for your attention. Remember to listen to these in 7 to 10 minute increments. Take notes if you can. Ask questions, reach out to me, and hopefully this information will help you improve your own education and support the resolution of your chronic gut issues.